Part of the whole Make America Healthy Again shtick, touted by Trump and RFK Jr. on the campaign trail, is that Americans need to have better food to eat, which, true, absolutely. And yet, Trump's USDA just canceled 2 federal programs that literally did just that. Programs that gave $1 billion to schools and food banks to buy food from local farms. Just a total win-win, right? Kids get better food, farmers get money, and Trump just chucked it all away without a single solitary peep from his new Secretary of Health and Human Services, so that's his whole bag, right? Well, you see, he was too busy basically cutting an ad for a fast food restaurant that switched to cooking its fries in beef tallow, which RFK Jr. says is healthier.
Steak and Shake just switched out, and people are raving about these French fries. Today, the best French fries in the world are in Europe. I order them every time I go to Belgium or France or any place else. And the French fries here just don't taste right.
Okay, well, thanks for that, Mr. Secretary. While he's doing that, the deadly measles outbreak was spreading. There have now been at least 280 cases of measles reported since the beginning of the year. That's compared to 285 cases recorded in all of 2024. And we should note that health officials in Texas warn the reported number of cases is likely a large undercount because many people aren't getting tested. The man in charge of American health, when he's not chowing down on those delicious beef tallow fries, keeps casting aspersions on the measles vaccine.
It used to be when you and I were kids, everybody got measles. And the measles gave you lifetime protection against measles infection. The vaccine doesn't do that. The vaccine is effective for some people for life, but many people, it wanes.
Dr. Ashish Jha is the dean of the Brown University School of Public Health. He served as the White House COVID response coordinator under President Biden. Just this week, he penned an op-ed titled "Measles is Back and a Lot More People Are at Risk." And he joins me now. It's good to have you, Dr. Jha. I got to say, I thought I was having like a stroke when I was listening to Robert F. Kennedy Jr. describe that, because this was exactly what people would say about COVID. Oh, well, the way to get immunity is to get the disease. But then my understanding is that we figured out this very cool hack where you could get the immunity without getting the disease, which is called vaccination, which is the whole point. Like, what am I missing here?
You're missing nothing, Chris. And first of all, thanks for having me back. Look, this is 200 years of medical progress. We have figured out exactly that hack, that we can get your immune system prepped and ready without having to get really, really sick. And Robert F. Kennedy, I think, wants to bring us back to the 16th and 17th century, when the only way to do it was to rough it, get infected, have a lot of kids die. But that's how we got population immunity in the past. We don't need to do that anymore. We've learned a lot.
Yeah, I mean, this idea that we all got measles and, like, how bad was it? My understanding is it's pretty bad. Like, a lot of, like, measles is, I mean, this is, I sound insane saying this, but measles is bad, correct?
Correct. So, a lot of people ask me, they say, well, humanity has survived for centuries without it. What did we do without vaccines? I'll tell you what we did without vaccines. We buried lots and lots of children.
Yeah.
There is no reason to go back to that. Kids die of kids die of measles. Kids die because they get encephalitis. Vaccines are the one thing that really prevents measles.
He also said in this interview, which, again, I just found so both sort of distasteful and also wrong, was like, well, healthy people don't die of measles, and there's a food desert in West Texas, which, again, like, I don't know if there's a food desert or not. I think the Mennonites are probably eating pretty healthy, to be totally honest, where this outbreak happened, but that's neither here nor there. But, like, all that just seems completely not the point about what's happening here, but the level of the health of these kids as the determinative factor of this the problem with measles.
Yeah, so this is part of a long-standing campaign, Chris. Obviously, we all agree eating healthy, exercise, those are good things to do. One of the things that the anti-vaccine crowd has done is blamed all of these illnesses on anything but the lack of vaccination.
Right.
The Mennonites actually are well-nourished. They're not lacking in access to good food. Kids who are healthy and well-nourished get very sick from measles.
Yes.
This is all a distraction. We've got to focus on what matters, which is building up immunity, and the safe way to do that is through vaccines.
You worked in the upper levels of the American public health bureaucracy at a moment of very important and difficult calls to make. Does it matter that the top health official sounds like this? And like, does it, or does it not? Are people going to do what they're going to do independent of what he's saying?
Oh, it matters enormously. And this is why previous health secretaries of Republican and Democratic administrations have leaned in heavily towards what the scientists at the FDA and CDC are saying. They have not held their own idiosyncratic views. By the way, that has been a bipartisan tradition in our country. RFK breaks that tradition and brings views into the conversation that confuse people. And when you confuse people, you see what is happening in West Texas and elsewhere across the country.